Hi, it's Carolyn. I'm a trichologist here at Absolique Health Clinic, and today we just want to show you how we use our microscope to analyse the hair cycle and also different types of pattern thinning. So you must understand the differences between the two. So we've got a lovely model here today, and we're going to go in and we're going to check the entire hair cycle, and we do that by reading the terminal area, because this area at the top and the recessions, crown, it can be affected by male pattern thinning and DHT, which is dihydrotestosterone. So we need to read the hair cycle first. So this terminal area demonstrates the hair cycle, because you never lose the terminal area with pattern thinning. Why? They still don't know. If we knew that, well then we wouldn't have this problem with DHT. So we're using a live video microscope, and I'm going to go in and I'm going to capture a picture of the hair cycle. Okay, so then we come back and we're going to read the picture. So this picture here is 1 centimetre of the scalp, and in the terminal area every hair side by side is supposed to grow exactly the same. It's your genetic hair type, so you don't have one thick hair, one thin hair. So when I go in close, I can see that this is the hair strand, how it should be growing. It's nice and strong and shiny, and just in here it's the same and the same. And you may not be able to see it from back there, but there's these tiny little cobweb type hairs. You can see that they're hairs, but they have no colour. They're what you call translucent. It shows that they're not growing properly. So we know when we see those hairs on the surface of the scalp not growing properly that there's something definitely going wrong down underneath the scalp in the dermis, and that's where the hair bulb and the hair cell lies. So we see that in one picture. We know that this is the entire hair cycle, and every time we go back in and take a picture in that terminal area, it looks the same. So what we're showing you is that this is diffuse. So we have our normal amount of hairs growing, and then we also have these translucent, or what we call thinning hairs. This type of thing can be caused by stopping and starting medications, body imbalances, that includes iron deficiencies, not so much extreme anemia, blood sugar fluctuations, thyroid fluctuations. A lot of nutritional deficiencies can cause this as well. Anything that can disturb the body that affects the cells can actually make the hair cells not grow properly, and also trigger what we call diffuse hair loss. So you've got diffuse hair loss and diffuse hair thinning. So by gaining the history of your patient, you can sort of find out what it is and then go forward with some treating the cause, and then going and treating the symptom to get a result. We then say, is there something happening in the pattern thinning area? So we're going to go in on our model and we're going to have a look at the recession area. So I'm just going to have to lean over here. What we want to see is the picture different from that of the terminal area. Have the hairs changed? Has the diameter of the hair changed? Has the distribution of the hair changed? And the answer is yes. So you can see there that there is no terminal areas. There's a lot of these thinning hairs as well. So this is happening in the recessions, which is specifically the pattern thinning area. When you see that, you know for a fact that there's DHT, dihydrotestosterone, there. So you must go in and address the hair cycle, the causes and also the symptoms, as well as the DHT. So with the DHT, it's coming from inside, so we must protect the hair bulb from the DHT, internally, externally, and then actually move it away. So you can see why understanding the proper causes will help you to get the correct treatment. So always go and get a professional diagnosis, make sure they're using a microscope and understand the hair cycle and can explain those things to you. We're here to help you with your hair loss. We do in-clinic consultations. We also do Skype consultations and phone consultations. So I hope that helps. Carolyn here from Absolique.